Okay, after finishing a system review and ruling out all of the red flags, the next thing that I would do for a dedicated examination of the knee is just start to observe Famita's posture. And the first thing I'm looking at is from the foot all the way up to the top, I'm looking at the foot and the knee joint lines, and I can tell like that she does have a little bit of on the right side, actually, let me go on this side. Actually, she has on her left foot, she has a little bit of pes planus going on, and I can also see a little bit of valgum happening in the knees. Can you turn and face the wall? Also, I can see a little bit of recuverum, or hyperextension of the left knee. I'm going to cross in front of the camera again and face that way for me. Again, I'm seeing some I'll be looking for abduction or adduction of the calcaneus, and I can see that happening here at the foot, which the reason we're looking for this is because it's going to affect the knee joint. And we can see that she has some abduction of bilateral calcaneus. Hopefully you can see that in the camera. And the next thing that I'm looking up at the hips, she might have a little bit of elevation on the right hip from this view, but we'll look at that a little bit further. Okay, Famita, can you walk towards the door and just back to me? Now I'm looking to see if she is getting a heel strike and toe off. I'm looking to see if she's protecting her knee. I'm looking to see if she's getting any internal rotation of the tibia, external rotation of the femur. Can you walk this way and back that way? Again, I'm looking for some of the same kinds of things. Do we have a heel strike, toe off? Is she pushing off with her big toe? Is there any hip drop? I'm looking for those kinds of things. Okay, now will you also, I'm just going to do a screen, and it also will tell me how badly the pain is affecting her. I'm going to have Famita go ahead. Can you walk a few feet on your heels? This is going to test L4 nerve root. Okay, very good. Now going back that way, can you walk up on your toes? S1, is it hard in those boots?
No.
Or are you having a difficulty? Can you do that for me again? Walk up on your toes. Okay, very good. And then back this way towards in front. Very good. All right, and stop there. Now can you just do, I'm doing some functional tests here. Can you do like kind of a squat? You don't have to go all the way down. Just show me your squat. I'll be looking to see if she has any valgum of the knees or varus of the knees. You come back up, hon. Sorry. Or a lift off of the heel if she's favoring or over quads or hamstrings. Turn around and just do a quick squat down and back up, just nice and slow, and back up. And I'd like to look at it from that side. Okay, turn back around for me. Can you do a single leg stance on the right or left? It's fine. Right. Very good. Now can I see you do it on the other leg? Yeah, I was thinking that our left is having some difficulty. Okay. All right, so the next thing could you try to do for me, nice and easy, but if you're having problems, can you bend over and just touch the floor or go down as far as you can without any, don't cause yourself any pain. Okay, so a little bit of limit there. Okay, all right, turn around and face the doorway there. All right, now I'm going to come and I'm just want to find out her iliac crests. I'm looking for any hip height changes, PSIS, if they're level or off. I can come to the greater trochanter and see what those levels are. I also, if I want to check the knee joint line for leg length changes, but I'd have to confirm that on the table. Go ahead and turn around for me and face me. I can also check from the front view and check her hips and the ASISs. I also prefer to check this sometimes on the table, but this is also more functional. And everything looked pretty good there. All right, now I'm going to have you come on over to the table, and I'm going to have you sit up on the edge. Let me make sure. Just going to make sure that we can see. Okay, I'm going to just do a gross screening of her strength and the myotomes. Can you lift up your knee and hold for me? Hold, 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 hold. And then this one. Hold, 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 hold. Very good. Now don't let me pull you. Hold, 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 hold. And then this one, don't let me pull you. Hold, 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 hold. All right, can you lift your toes up towards the ceiling? Don't let me push you down. Very good. All right, so go ahead and lay down. Check the passive range of motion. Can you bend your knee up as far as you can? Good. And that looks pretty normal. And as straight as you can, it's pretty normal. Has a normal firm end feel. So let me check the range of motion. Bend you up. And I get 0 to 135 is considered normal. I have about 126.7 to about 127. She has a soft end feel when I bend her and a firm end feel when I straighten her out in extension. Now I'm going to check do some palpation around the knee, and I'm going to start in the middle, just inferior to the patella. After I bend it up the knee a little bit to open up the joint, and I'm just going to be pushing down on the patellar ligament to the patellar tuberosity. Just feeling around and asking if there's any major tenderness or if it produces any of the pain that she's having. Then I'm going to move to the medial joint line and ask the same questions. Move a little bit, the lateral joint line, ask the same questions, and then move a little bit more laterally and move down and find the fibular head. And then I'm going to look for the rope-like structure, which would be the LCL, lateral collateral ligament. And I'm going to palpate it all the way up to the femoral condyle. Now I'm going to come back center. I'm going to do the same, and I'm going to move medially, palpating the medial joint line, looking for tenderness. I'm going to move all the way over to the medial side, and I'm going to get on the medial collateral ligament, running from the tibial plateau. I'm going to move up to, just keep palpating along until I get to the femoral condyle, looking for tenderness or what have you there. So the next exam that I'm going to do is to check for, I'm going to check the integrity of the medial collateral ligament, and the first thing that I need to do is to test it in 0 degrees. So I'm applying a force medially, And then I'm going to bend her up to about 30 degrees. And I'm looking for any excess movement. There we go. And the next special test that I will do for this eval is the Lockman. I'm going to use the towel roll. Hopefully that'll be enough. And I'm going to use a version where I can drop the foot off the table slightly. Hope that you can see. And then I'm going to stabilize the femur. And just do a quick up pulse. Okay. And that there is the end of the eval.